Good afternoon. I was just wondering, first of all, appreciation for those of you who have stuck it out with us to the very end of the day. I know it can be as amazing as our last panel was. Sitting in a dark room can be not the most energizing, so I'm actually going to ask everyone to stand up. And stay standing for a second, because I can't actually totally see you. Sit down if you were here 9 years ago. Oh, I see some people sitting. Sit down if you have been to more than 3 HCPLAN summits. Sit down if this is your first HCPLAN summit. Okay. All right, everyone else can sit down, because stay seated if you're planning to come next year. Okay, good. Everyone's going to come, because next year is our 10th year anniversary. So it's kind of like my college reunion. I showed up at the 20th anniversary, and it's like, oh, I'm here for the big one. They're like, no, actually, it's the 25th. So regardless of a lot of you, this was your first one. It will not be your last. We expect you to come back next year for our 10th. Another interactive piece here. Who here is from a purchaser? I include CMS, CMMI. Purchaser or purchaser adjacent? All right. Payer or payer adjacent? Provider or provider adjacent? Okay. I think some people are a little tired. Their arms might be a little tired. But what has really struck me today is that we've come quite far as a community. You saw that in the results of our measurement effort annual survey. And what I heard today was our collective knowledge, some battle scars, some hard-won wisdom. Sometimes it feels like we can lose the forest for the trees and all of those jargony numbers that I am guilty of throwing out. But today I really heard a through line from policy to payment to practice. And I think the fact that we have good representation from purchasers, policymakers, payers, providers, is what makes that possible. I'm going to spend just a couple minutes reflecting on today. This is kind of when you teach, you tell people what you're going to teach them, then you teach them, then you tell them what you taught them. That's this third part. I'm going to review what we did today. So we started off this morning by hearing from CMS leadership about payment reform, not as a means to an end, but as an enabler of care delivery transformation, and importantly, anchored on really core principles around access, affordability, and experience. When I think experience, I think both person, patient, member, as well as provider, because we've talked a lot about how much stress the delivery system has been under. This morning's breakout sessions focused on really foundational elements. And these are things we've been talking about from the beginning, and it feels like the conversation has matured. Aligned quality measurement. Yay, that's my soapbox. Parsimonious set of measures that matter. Standardized data, sharing incentives for health equity, and care delivery principles. And then around midday, we transitioned to real life use cases. We heard about adoption of bulk fire, related APIs, health equity programming, including working with community health workers and other community organizations. And then I think a real mark of our maturity is that we were able to talk about moonshots and belly flops. I mean, you have to have some experience under your belt, be able to talk about where things went wrong and what you learned from them. And then this afternoon, we looked ahead to the future of value-based care, rapid cycle measurement techniques to continue innovating our programs in a rigorous way, so knowing what actually works. New key partners like purchasers, and I just want to put a plug out there, more than 50% of Americans are insured by their employer. If we only look under the Medicare Advantage or even expanding it to Medicaid, that's not going to move the entire system. So partnering with purchasers, and importantly, rural health. Which is, I think, an area that we really need to delve in more in the coming years. And then, as we heard from our last panel, our annual measurement effort, we're moving in the right direction towards the 2030 accountable care goals. Bottom line, overall, more people are enrolled in accountable care relationships, and more money is flowing through APMs. So the goal today was to really use these insights to help us collectively continue to innovate and drive positive change. A few thank yous. First, to our panelists and moderators for your expertise, candor, commitment, and inspiration. For our attendees, so I don't know how many virtual attendees we still have with us, but thank you for joining us. But in particular, thank you to all of you in the room. I hope it was worth coming for the conversation and engagement, because I know you didn't come for the food. Just saying. And then thank you, the HCP members and leaders, for your engagement, your time, and everyone who contributed their time and data to the HCPLAN measurement effort. One last thank you to the HCPLAN operator team who really made all of this happen so seamlessly. And then I just want to finish with a call to action, or a couple, three. The first one is, were all of you here for the morning session with Dan Tsai? Yeah. Okay, so Medicaid is my first love also, but I think what he said about his hopes for his successor, that we create a Medicaid system that we all would want to be a part of and that our families and friends deserve, that can be generalized to the entire healthcare system. So let's all of us, all of us, work towards a healthcare system that we would want to be a part of, to receive care in, and that our families and friends deserve. The second one is stay connected, stay engaged, lean into this community. There are so many experts and so many people who have done the work here. And again, turn to your fellow providers, turn to your fellow payers, but better yet, cross those silos to figure out how do we really start aligning from purchaser to payer to delivery system. And then lastly, take advantage of HCPLAN and all the resources we have. And I'm just gonna bear with me for a second because there are a lot of them. Go to our website. It is hcplan.org. There are recordings of today's sessions. There's the APM framework, which you've seen, the accountable care curve, alignment landscape, person-centered healthcare priorities publication, ACAC's guidance on advancing health equity through APMs, HEAT's social return on investment grounding document, and details of this year's measurement effort results. So again, that's just a smattering. Please, I mean, these resources were developed for this community. So please go there, take advantage of them, share them with your colleagues. The last things I would say are, remember, no one is coming in to solve this for us. This is for us to come together to solve. Huge thank you for your partnership and leadership. Safe travels, and see you next year. Because you all did say, stay seated when I asked. I'll see you next year.